I'm trying to get a feel for when I'm in my zone there doing my thing, what you're feeling versus what I'm seeing objectively on the data, the way they're coming together. Does that make sense?
Yep.
It's not a scary day. This is not scary.
It's not.
No. Promise. Don't. This is very minuscule. I mean,
Yeah.
between today, now and an hour and a half from now, the only difference will be your canines will be a little thicker, tiny bit taller. You might feel a little bit of roughness on a back tooth or two, barely, which will wear down on its own. I've done almost nothing.
Mm-hmm.
It's just where I've done it and when I've done it, relative to how everything moves. That's going to change slightly. And most people will feel, at the end of the day, I'll ask you how you feel, and you're going to tell me, and I'm not going to put words in your mouth, so I better not say anything.
Mm-hmm.
But you've seen a few of the videos, you kind of get a gauge for what they
Mhm.
experience. Everyone's different. So the bottom line is that neural occlusion that we did yesterday, that screening, I call it neural occlusion. It's just my gadgets, my experience, my knowledge of what's going on in the top and the back side and the front side, the teeth, backside joint. So it's not just a T-scan. And a lot of people just don't get it. And we get calls all the time, like, who in my state does this? Honestly, nobody. I'm sorry. Maybe eventually.
Mhm.
One of these days I'm going to start teaching with others. And there's a handful of us that understand what I'm doing. But honestly, no one's doing exactly what I'm doing. Our minds are more open than the rest of the guys. Does that make sense?
Mhm.
Yeah. My philosophy is not just one thing or two. It's many, many, many things. Does that make sense?
Yep.
Where are you from?
Minnesota.
Minnesota. And why are you here?
To try to get some relief from grinding
Okay.
and the sensitivity of my teeth.
Okay. How long has that been going on?
I would think it was started 20 years ago.
All right. So did you have braces?
No.
No. Did you have any kind of dental work around that time? Do you remember?
No, just a lot of fillings when I was younger.
Who have you seen for this? What kind of healthcare providers?
Just a regular dentist,
Uh-huh. Chiropractors?
chiropractor to get relief
Physicians?
from the tension. Physicians have prescribed medications
Okay.
for the, trying to get the muscles to relax,
Muscle relaxers?
relaxers, yeah.
Like Flexeril, that type of thing?
Mhm.
Did it help?
For a night maybe. But,
Yeah.
It's,
So a typical night or is it worse in the morning, I assume?
yes.
So a typical night, you're sleeping, you kind of can't, it wakes you up, or how is it?
Yeah, I usually wake up during the night. I don't sleep. I'm constantly
Wired?
trying to either put my hand, like sleep on my hand where my jaw is,
Yeah.
so my teeth don't come together.
Mm.
Wearing night guards.
Professionally made or just over the counter night guards?
Both. I've used both.
And did you have any resolution?
No,
Not really?
I was ready to get another mouth guard,
Yeah.
and then I,
Tried someone else's,
yep,
and then it didn't do much either.
no.
Didn't you tell me you used to be able to bite your nails?
I did, but that was filed.
Right,
This was
right.
once that got filed, I couldn't.
Right, I remember
That
that.
was later 20s.
Yeah. So okay, so it was only then.
Yeah.
Yeah.
And then this all started in my later 20s.
Yeah, and then you've been through various splints. And all this.
Correct. Yep.
So, believe me, splints move teeth.
Yeah.
It's just like orthodontics. So my prayer is that splint therapy is what's caused you that little bit of separation.
Mhm.
Instead of it being something foundational, i.e. the joint, the cartilage, the bone. So I will be, totally surprised if you don't get at least some resolution out of this. That's the whole point of yesterday.
Right.
I nitpick to make sure that this looks like it'll work, because I don't want to waste my time and your money. It's not just money, it's, am I going to help this person or not?
Right.
Yeah, and I'm doing everything I can to get you, not to see a surgeon.
But if I go one night without the mouth guard,
Okay.
I would get a severe migraine that lasts for 3 days. Go in, I get a shot of Toradol, sleep it off for 3 days, and
Gotcha.
start over again the next week. But
So it's not just clenching and grinding, you've got bad headaches.
severe, yeah.
And can you point to where they hurt? Where do you feel the pain for the headache?
The tension starts here,
Yeah.
and then the headache will start in the temple,
Gotcha.
and then it just gradually goes to the back, and then down the neck,
Mm-hmm. The base of the
And
skull?
yep, and then the tension down the shoulders.
It'll bleed downwards.
Yep.
But it starts around the cheek muscles and
Yep.
up in the temple.
Yep.
Are your teeth cold sensitive? Do you have a lot
Yes.
problem with that?
Yes.
How bad? Severe or?
Enough to where I have to, if I'm eating something cold, I have to only use certain teeth to eat.
Can you chew gum?
No.
Does it make you tired?
Yeah,
Hurts.
instantly. Yeah.
You're done.
Yep, I can't do
You
it.
spit it out, the taste is still there, it's like, I can't do this.
Yep.
Would you say that your normal activities have been like completely disrupted for more than 11 of the past 30 days? Like the last?
Yes,
See what I'm
daily.
saying? So
Yeah,
it's
I
daily.
spend 2 hours every day doing some type of exercise or stretching to try to relieve the muscle pain.
Okay. You go to the chiropractor quite often, and you said something about, you said he's different, he does torque,
Oh, torque release.
torque release. Does it help?
So it helps with my neck.
Okay. So like maybe the headache, pain, and tightness that's down at the base of your skull, that feels better after he's done?
Yep, it kind of all reverts backwards. So
Gotcha. Yeah.
so the pain starts going back here and here and back down to where it originated.
0 to 10. Ice water.
7.
About 7. Is it aching right now, even after you swallowed it, or not really?
The top teeth are sensitive.
Gotcha. Bite home hard. Go out to the right and open. Like you were telling me, you feel like you hit too hard on your right back, right?
Mm-hmm.
You do. So your subjective comment has merit.
Mm-hmm.
This kite thing here is like the summation of the average, forces happening at that moment. You're definitely banging this guy too hard. All right, so you're right. Now you're trying to go off to your right side. You should head towards your canine. And you don't, you never hit it. And over here, your muscles are going crazy the whole time. They just don't know what the heck is going on. And they're angry and they're tired and they're done. Kind of like you are.
Exactly.
Yep.
It already feels like they're starting to relax the muscle.
Does it?
Uh-huh.
And by the way, your old silver amalgam fillings, that's part of the reason the 3 in a spasm. When I do this stuff, I dial back time.
Okay.
And it's not all 100% accurate, but because teeth drift and move a little bit over the years, but it's almost like, okay, this was the first thing that, in other words, you throw one thing off in the beginning, then you throw other layers on top of it. So I take away the top layers, and then all of a sudden I get down to that core thing.
Okay.
On your right excursion, it was your old silver filling over here.
Mm-hmm.
Probably when you were, I don't know, teenager maybe?
Right.
This feels more relaxed.
More relaxed? So that's not so tender anymore, is it?
Mhm.
How about this side?
Feels good.
Not too bad? Ice water real quick. Okay, we're only like halfway done, but go ahead and swish for me. Zero to 10.
Like a 3.
Better,
It's
isn't it?
like, yeah.
You feel it where? Way in the back?
It's like gone where it usually is.
Uh-huh.
Maybe a little bit back here, but
It's different.
it's way different.
Got it. What do you feel right now? We're only halfway there. Let's feel it.
I feel like I want you to do this side.
Yeah, 'cause
You know?
you're right. Your
Yeah.
right feels good, doesn't it?
Yeah, it just immediately relaxed the muscle.
Yeah. Feels kind of flaccid, doesn't it? Like loose.
Right, yeah,
Mhm.
it's,
And it's
daily.
unilateral right now, right?
Yeah, and, daily I have to keep my tongue on the roof of my mouth, like, all the time now.
Yeah.
So all day long, I'm trying to hold my teeth apart.
Yeah. So now all of a sudden you're noticing a little bit of difference.
Mhm.
It's like, give me more, right?
Yeah,
That's fair.
yes.
And the cold thing, see, that's profound.
That's- Yeah.
I'll try it again. I'm not trying to torture you.
No, I'm like, how did that work?
I know, right? Swish it. 0 to 10.
Yeah, it's just like barely over here
Yeah.
at all.
But it's profoundly different.
Yeah.
Give me a number, just what do you think?
1.
Wow. Yeah.
I'm like,
Yeah, we're not even done yet.
right.
Yeah. Told you.
I'm gonna have to have a burial service for my mouth guard.
All your mouth guards?
Yeah.
Like a pet cemetery?
Yeah. Oh, that'll be nice.
I love it. That's funny. Most dentists think that the bite directs the joint. It's the opposite, for the most part. So the teeth can jack with the joint a little bit, but only on that lateral pull. Remember that outer
Yeah.
half towards
Yeah.
the outside world? The medial pull towards the inside world, the bite can't mess with that. So the bottom line is that's to really mess up a TMJ, you've got to mess with a medial pull, and the bite can't do it. All right? Now, you may have had a little bit of trauma that did mess with your medial pull, assuming that bite gadget, the JVA, was right.
Mhm.
And that's okay, but it seems to be responding, so I don't care too much, you know?
Right.
So it's natural and physiologic for you to clench and grind a little bit still.
Mhm.
Remember that.
Yep.
But it shouldn't be anything like it was before. Before, they were both working.
Okay.
Now he's relaxed. Okay, and it has to do with muscles that are internal too. So it's not just that. The master on this side is chilling out as well, whereas he was off the charts earlier. He's starting to chill. So that's what you're feeling, that profound relaxation. It's in your masters and in your medial pterygoids, which I don't have an electrode on. There's like a sling holding the mandible. The masters on the outside, the medial pterygoids on the inside. They're both like just, the lactic is like, ah.
Releasing.
Yep.
Yeah.
Do you feel tingly at all, or what does it feel like?
I don't. I just, even when you put the bite screening in there,
Uh-huh.
I'm actually able to open my mouth
Bigger?
at a relaxed, rather than trying to think about opening my mouth,
Uh-huh.
because my muscles were so tight.
Yes.
So I can actually just open my mouth.
And that's like a new sensation, isn't it?
Yeah.
Don't cry on me now.
I might. I might.
I'm giving you a hard time. I
No.
know it's, I'm sure that's what it feels like.
Yeah.
And you're welcome to do whatever you need to do. What do you feel like right now?
Just completely relaxed.
Do you feel sleepy?
Mm-hmm.
Like
Like
you
I
had,
could go to sleep.
like you had a good massage?
Mm-hmm.
Is that fair?
Yep.
How's your neck feel?
It's good.
Move it like left and right, like you're backing up a car or something, you know?
Yeah, it just feels like tension's
We're all doing
gone.
it.
Oh yeah.
We're all like.
Oh, it feels good. Yeah. Yeah, I usually work for hours, trying to get relief. You know, exercises and.
Stretches.
Mm-hmm.
What's it like?
Probably like a 1.
No big deal?
No big deal.
Compared to,
The 7 I was at earlier.
what, about
Like.
an hour ago, right?
Mm-hmm.
And yesterday, you were sensitive.
Mhm.
Last week, last month, last year,
Yep.
like every day, all the time.
Oh yeah.
A little different, but always sensitive.
Yep.
Consider yourself sensitive now?
No.
No big deal. So you could take down a smoothie or a milkshake and not writhe a little bit in pain, right?
Right.
Your neck feels good?
Yeah, it actually just let loose.
You kind
On
of
the
felt
left.
something give?
Yep.
How about your, did you have a headache walking in?
Yes.
Do you have it now?
No.
Is that unusual?
Yeah, I usually always have a mild temporal headache.
Is it gone?
Yeah.
What's your face feel like right now?
Just completely relaxed. Even when you put the little guard in, I always have a hard time with that.
Yeah.
And after you did the right side, and then you put it back in, it always feels like my muscles are shaking.
Yeah. And you weren't
And
shaking anymore?
No, it was just relaxed.
Yeah. How's it feel to be fixed?
It feels way different. Amazing.
You glad you had it done?
Oh yes.
You're gonna let us know? I'm gonna post this thing under comments, okay?
Okay.
Let me
Oh
know
yeah.
over time,
Yeah,
please.
you're probably gonna get a Christmas card.
I don't know if I deserve that.
Yeah.
This could break because we bonded the 2 canines. So I'm going to record this on the CAD cam unit. We're going to take a digital image, and should you ever break it off, you come back and I replicate it in porcelain, and I just lay it back on top of the canine.
Okay.
And it's going to be within 0.03 of a millimeter of where it was.
Okay.
It might be a good idea to, in your case, eventually come back and let me make those out of porcelain. Okay? I'm not trying to spend your money, and it's just a suggestion, but eventually you'll break those bondings off. And by the way, most of the takeaway was old filling and crown, the vast majority, which we expected.
Right.
So what does that tell us? That tells us your dental work was a very big contributor to this whole problem,
Mm-hmm.
which makes sense. Your joints look pretty good, and I think this should work great.
Thank you.